Right, we begin here. Today is World Asthma Day. The day is organised by the Global Initiative for Asthma, a World Health Organization collaborative organisation founded in 1993. WAD is held each May to raise awareness of asthma worldwide. Although asthma cannot be cured, it is possible to manage asthma to reduce and prevent asthma attacks. This year's World Asthma Day theme is Uncovering Asthma Misconceptions. For more on this, we're now joined by Dr. Lethabo Machaba, a pediatrician. A very warm welcome to you. Thank you so very much for being with us, Dr. Lethabo.
Thank you, Flo, for having me on the show. And I would like
welcome.
to send greetings to all the SABC viewers.
You're most welcome. Doctor, let's talk about, I mean, the fact is all of us, or most of us, really do know someone who is living with asthma and perhaps might not know the details really of what asthma is. We just know about the asthma pump and that they have to use it. Let's talk about the condition, what it is. And as I've said, the theme this year is Uncovering Asthma Misconceptions. Perhaps let's talk to that too, Doctor.
Absolutely. Asthma is a chronic disease, as most people with asthma or children with asthma will know. Unfortunately, most of the time we can control it, but we can't necessarily cure it. What usually happens is children will come with and present with a cough that happens mainly at night, seasonal in nature, complaining of issues such as wheezing and a tightness of the chest where they feel like they can't breathe. And centered around that is then we as doctors then diagnose this and come up with a management plan. The main misconception that I'd like to raise continually is when it comes to the management of asthma. We struggle to get the message across to the parents that, you know what, we need to actually use your asthma pumps, mainly your maintenance therapy mostly, and not necessarily the reliever pumps, which are blue. We are so absolutely happy with the new GINA guidelines, because that emphasizes that patients need to use more the maintenance therapy and not necessarily use the reliever pumps, which are the short-acting beta-2 agonists, as we call them, SABA.
Yeah.
So now what we want to actually uncover and communicate to our public is that parents do not be afraid to control asthma with the pumps. It's very important that you're compliant. It's very important that your child takes the maintenance therapy every single day and also takes it and also takes the reliever pump when they need it. Also, what's so exciting, Flo, is that we also have online platforms now where parents can actually do a 5-question questionnaire on your rate, your reliance test. You can also access it on your Yes to Breathe campaign and the website that AstraZeneca is running. So it's so exciting to actually manage asthma in these times because I specifically work in private and even in public, a lot of people are actually on online platforms.
Yeah. I mean, as a pediatrician, I'm sure you see a lot of cases of asthma in children. Has it gotten worse or better over the years? And the reason I ask this is because, I've heard that asthma is, exacerbated by fumes in the air. And we know we're dealing so much with all this toxicity in the air. And I wonder if over the years, that's having an effect on children. And if you're seeing more cases of children having to kind of live with asthma.
Flo, I've so mentioned that what you have just mentioned now is the triggers of asthma. Because now in South Africa, there is an improved education and access to healthcare. When I started my registrarship, that is when specializing as a pediatrician, I was at Baragwanath in Joburg. And I must say there was a big difference when I compared it to my internship, which I did in Tembisa.
Yeah.
So over the years, even the statistics are showing that although we still get mortality, which is death from asthma, that has improved. The later studies are now actually saying that there's actually more burden of disease and actually the morbidity, which means that we see them, some of them might not be dying, but we are still struggling to actually manage and control the disease. So I'm so happy you mentioned the fumes. It's not just fumes, it's dust, it's grass. Some people actually, it's even food allergies.
Yeah.
So we still need to actually educate our public about asthma as a disease. And that is why I'm also on this platform to actually plead with our public to say, we can help you as medical practitioners. Our government is behind us. There's so many online things now. AstraZeneca is on board. So many initiatives like the Yes to Breathe, which you can access online. So there's no need for us to not control this asthma disease.
Yeah, I mean, it's quite staggering, the number that's been recorded by WHO, and of course it's an estimated figure that I did see on their site of people living with asthma, and they put it at a figure of 339 million, and that's of course a global figure. One can then deduce from that figure, and you're talking about deaths from asthma. If I look at that figure, I'm then concerned about how many deaths could come out of 339 million cases globally of people living with asthma. And although you're talking about the fact that there is, of course, it's more controlled now and so forth, but maybe you can paint a picture for us in terms of deaths from asthma. Are we seeing a lot of that, or as you've put it, there is kind of those controls and those measures in place, and that there isn't that much of it?
Yeah, absolutely, Flo. So I don't have a specific figure for you, but what I can tell you is, as I said, the researches that have come up and the statistics that are being put forward is that with adults, they are talking about a 15 to 20% of, like, specifically in South Africa, of adults suffering from it.
Yeah.
In children, it's about 20%, which is a bit more. So in terms of the deaths, speaking from clinical experience, I can say definitely it's still there, but I definitely believe there's definitely an improvement because of the issues that I previously mentioned, access to healthcare, and also the fact that there's more alertness and awareness in the public. Do we still have a great job to do to educate? Yes. Do we still need to encourage parents to consult with their children? Yes. But now there is, even with mining companies and all of that, they are also running programs where even adults and children are able to access those platforms if they possibly have like a cough that's not going away, or a wheeze, or any features associated with asthma, which I mentioned, like the tightness of the chest.
Yeah. Doctor, it's been a pleasure speaking to you. Thank you for shedding some light on asthma, and it's something that's not really always being shown and spoken about, and I appreciate your time. Thank you.
Thank you very much, Flo, and thank you to all SABC viewers.
Most welcome. That's Dr. Lethabo Machaba, who is a pediatrician, as we commemorate World